I'm Dr. Leo Powers, and I'm going to talk today about visual and auditory sensitivity and how it actually happens in the body and a treatment that helps with that. So this is part of the series of lectures to let you know how your body works. So basically I'm in Plover, Wisconsin, and this shows what happens when you breathe in and breathe out. When you breathe in, the CSF goes down, the cerebral spinal fluid from the brain goes down to the pelvis, and your sacral apex actually goes forward at the same time. And when you breathe out, then the sacral apex comes back up, and the iliums flare back in at the same time, and that pushes the CSF back up. Because when your head squeezes in this way, and the pelvis moves in this way, then the fluid, if it's down, it moves back up. And so this is more visual, and this is more auditory. So there's a connection between that, this is exciting, and the toe in and toe out. So when you toe in, that contracts the muscle a little bit below the knee that helps to change the connection to the back of the knee, which is right here, and that's the hamstring area. The posterior thigh muscles are the hamstrings. And so there's 3 hamstrings, the lateral hamstring, and there's 2 medial hamstrings. And they actually correlate with the optic nerve up in your brain. And this is like the back of the head. It's like this, back of the head, and then this is the eyes up here. And so the back of the head, the left occiput area, supplies 3 nerves to the eyes. 1 to the outer part of that same side eye, 1 to the medial side of that same side eye, and 1 to the medial side of the opposite eye. And then the other eye gets the same double innervation, and then the right occiput would go to the outer part of the eye on the right side, the medial part on the same side, and then from here it would go to the medial side on the opposite side. So that way there's medial from the left and the right on each side, and that's what gives you binocular vision, so that you can move your 2 eyes together and you have binocular vision, so you can judge depth and perception of how far away something is. And so when you move your toe in like this, then this medial one contracts on both sides. And so that ties in with the medial over here. And so when you bring your toe out, the lateral one contracts on both sides. And when the lateral one contracts, that's when you get the flow of the cerebral spinal fluid down. And when the medial one contracts, you get the flow of the cerebral spinal fluid, or CSF, up. So I had explained in the other YouTube video about endurance muscle contraction for the muscle, to how to treat that. And so you do the same thing for the toe in, and you correct that first. And then when I was learning how to do this, I learned how to do this treatment about 15 years ago, and then I went to a seminar a year ago in December, and they talked about the importance of the gluteal muscles. And so I learned about the gluteal muscles, but I also learned about the lower legs, because you have to do that with the other part. And so I did that, got the treatment on myself, and I had broke my leg on the left side about 50 years ago, and it was a spiral comminuted fracture, so it was crushed, and so I had to have it in a cast for 6 months. It was a long time, and it was always not really strong, but I did this treatment doing the toe in first, and then the toe out after I fixed the toe in, and then the toe down, and that helped to move the CSF up. And then I did the toe out, and then that helps the CSF to come down. So it's better to do it that way than the other way, I found out. So I participated in a triathlon in Wapaka in August. I did a half-mile swim, 20-mile bike ride, and halfway through the back ride, my right leg started to ache a little bit, but not the left one, which was always the weak one.
and then I did the run, 3.1 mile. I did pretty good. It was a little over 12 minutes, but I trained for about 3 weeks before, so I didn't train a lot on the running. So I thought I did quite well. So I thought, oh, I got this figured out really good. So then I thought, well, I'm going to try it the other way. Try doing it the toe outside first, then the toe inside. And so I did that. I did a 1.5 mile run, and then I got a huge muscle cramp in my leg, and then I had to walk the 1.5 mile back because I was already 1.5 mile out. So I experimented on myself, and I found out the best way to do it so that you can get the best endurance. And it's really important that I will check, and we do the toe in first and then toe down, which correlates with the CSF coming back up, and then you do the toe out and the toe up to bring the CSF down. And I've used it with several different people, and they've had good success to help with the auditory and visual connection. And the other part of this is so the hamstrings are connected to the optic nerve. So there's a treatment that I learned how to do in the process where you stretch the hamstrings and you stimulate the hamstrings. In the Chinese medicine, there's an alarm point for the colon that ties in with the hamstrings right here besides the belly button. So I just put some black stones there, and then I move the eyes in these different directions. And I start up, then I go to the side, and then I go down, and then go to the side, and then I go up, and then I do the same thing on the other side, and then I come back to the left side. And some people have a wiggle from the right, and some have a wiggle from the left. And so the side that it wiggles from is what it's grounded to the earth by. And so I put these stones right here, and then do that. And then the range of motion in the hamstring and range of motion that I checked with people actually improved. And so then the energy that's in the body, the imbalance between the optic nerves and the hamstring, gets caught in the stones, and then you just take the stones aside and let it rest, and then it refreshes it. So that's the treatment for the toe in, toe out related to this is the auditory, and that's a visual component. And some people get headaches related to visual stress or auditory stress. And so by doing this, you can reverse that. And so we're at right down the street in Plover, Wisconsin. And our phone number is 715-341-7102. So please call if you want to make an appointment or need further information.